Hello, my name is Yesenia Reyes, and I'll be conducting a comprehensive physical assessment on our volunteer patient. So to begin, we're going to go ahead and start looking at general appearance, facial symmetry. We're going to start out with looking at the overall skin, symmetry of the face, looking for any drooping, anything like that. Also, just assessing like the skin on the back of the head, on the neck, and then we're going to go ahead and look at the facial muscles. Go ahead and raise up your eyebrows. Okay, puff out your cheeks. Show your teeth. Okay, and then stick out your tongue. All right, so we're just checking the general muscles of the face and seeing how they move. We're also going to be checking sensation of the face. Go ahead and close your eyes and tell me if you feel dull or soft.
Soft, dull, dull, soft.
Okay, so sensation is intact. Next, we're also going to be checking along the scalp, looking at just the hair distribution, feeling for any lumps or masses in the general scalp region, and also looking at the hair texture, any indentations in the skull, any discoloration of the neck. Okay, so we don't see any. And then we're also going to go ahead and, okay, next we're going to go ahead and check the lymph nodes from back here, checking in front of the ears, behind the ears, checking the submandibular lymph nodes and cervical lymph nodes. Next, we're also going to just feel the lymph nodes above the clavicles. Okay, and none are felt. Okay, for the next portion of the exam, we're also going to check out the trachea to look if it's midline. Go ahead and look up. And then we're also going to assess the thyroid. So we're going to feel first trachea, and then for the thyroid, go ahead and swallow. Okay, so we're feeling for the rise of the thyroid equally, and it is. Now we're going to move on to the eye portion of the exam. And we're going to go ahead and start by checking for visual fields by confrontation. So go ahead and close your, or cover your right eye, and tell me which finger is with you. Okay. Okay, go ahead and cover the other. Okay, same thing. Okay, so that is intact. We're also going to go ahead and look at just the general shape of the eyebrows. And while we're here, feel for the lacrimal ducts for any lumps or swelling. And then we don't see any, so then we're also just going to take a general look at the eyelashes, distribution of the hair. While we're here, we're also looking at the sclera, which is white on both eyes. Also keeping a lookout on the conjunctiva for any pink or redness. I'm going to go ahead and lift up your eyebrows. Eyelids, sorry. Okay, and the lower. Okay. All right, and then also at the same time looking at the iris, making sure it's equally round, smooth. We're going to be looking at the pupils as well and looking for pupil size. So, they're at about a 4 bilaterally. And we're going to go ahead and check for pupil constriction, both direct and consensual. I'll move you off the light, actually. Okay, go ahead and look straight ahead. And one more thing. Okay. So for both eyes at the same time, we're looking for direct and consensual constriction, which it was equal. And then next, we're going to go ahead and do the ophthalmic exam. And we'll turn off the light one more time. Okay, go ahead and just look straight over my shoulder. Okay, and we're going to go over to the other side. Okay. So first, we find it by looking for the red light reflex. And then once we are able to see inside the pupil, we'll go ahead and look for the optic nerve, looking at the vessels inside as well as the optic disc to make sure there's sharp edges on the disc. Okay. And for the last part of our exam, we're also going to go ahead and do the visual fields test. So we're going to go ahead and have you follow my finger with just your eyes. And then we're going to test for convergence. Okay, so while we're doing that, we're looking for anything like nystagmus, any abnormal eye movements, which there were none. Okay. And next, we're going to go ahead and move on to the ear exam. So first, we're going to begin by looking at the overall ears, looking at the shape, looking for any abnormal lumps or bumps. And I don't feel any or see any. Okay. And then next, we're going to also just do an inspection of the ear canal and look at the tympanic membrane. Okay. And while we're looking at the tympanic membrane, we're looking to make sure it's a pearly gray color, looking for the cone of light. As well as looking for any kind of drainage or irritation to the ears. We're also going to conduct a whisper test to check for hearing loss. So I'm going to go ahead and whisper something and tell me what you hear by covering this ear. Okay, cover the ear. Sorry.
Blueberries?
Okay. And now cover the other side.
Green apple.
Okay. So hearing is intact. And next we're going to go ahead and go down to the nose. So first we're going to look at the general shape of the nose, feeling the cartilage for any deviations, or looking for any asymmetry, which there is none. Next we're going to go ahead and check for smell. So go ahead and close your eyes and tell me what you smell.
Cherry. It's pumpkin spice.
Okay. So that is intact. We're also going to go ahead and palpate the sinuses and make sure there's no tenderness. Okay. And we're also going to check the turbinates and check for any inflammation or drainage. Okay, go ahead and look up. Okay. So no drainage noted, and the turbinates relatively unswollen. One side is always going to be a little bit more closed off than the other, but his are normal. And then lastly for the head, we're also going to go ahead and check the mouth, look at the lips, any discoloration, bleeding, ulcerations, lesions, anything like that. Go ahead and show your teeth. Okay, so we're also going to be checking out the gums, looking for any inflammation, bleeding, ulcerations. Okay, open your all the way. Okay, stick out your tongue and lift up. Okay, then go side to side with your tongue. Go a little bit slow. Okay. Okay. So with tongue movement, we're looking for equal tongue movement, looking for any ulcerations underneath the tongue, anything like that. I'm gonna go ahead and feel the inside of your cheek. Okay. Okay. And next, we're just gonna go ahead and take a look at the hard and soft palate. So go ahead and look up and open your mouth. So we're looking at any ulcerations in the hard palate or the soft palate. Go ahead and stick out your tongue and say ah. Okay. Let me just get my light so we can look at the uvula intact. Okay, one more time, say ah. Okay. So we're looking at the back of the soft palate, looking at the uvula for equal rise, and also taking a look at the Posterior throat, looking for anything like cobblestoning, any inflammation or redness, as well as looking at the lymph nodes for any swelling or any discharge. Okay, for the next part of the exam, we're going to move on to the thorax and cardiovascular. So we'll begin first in the back for the lung sounds. We're going to go ahead and just take a look at the general symmetry of the chest and feeling for, or sorry, the back, feeling for any lesions, masses, anything like that. And we're going to go ahead and check for symmetrical expansion. So go ahead and take a deep breath and let it out. Okay. So we're looking for equal movement of our hands with the expansion of the chest. Next, we're also going to go ahead and just do some percussion and listen for resonance in all different lobes. Okay. So in all lobes, it's resonant, and we're going to go ahead and also take a listen to the breath sounds. Okay. Let me take a deep breath. Out. Okay, so in the posterior chest, we're listening for any adventitious sounds such as crackling, wheezing, anything like that. And we're going to go ahead and move to the front, and we'll take a listen at the trachea and the upper airways as well. Go ahead and breathe in. Okay. Next, we're going to go ahead and feel for tactile firmness. So go ahead and say 99.
99. 99.
Okay.
99.
Okay. And then we'll check also from the back as well.
99. 99. 99. 99.
Okay. And then next, we're going to go ahead and move on to the heart sounds. Okay. Next, we're going to go ahead and move on to the cardiovascular exam. And first, we're going to go ahead and auscultate the carotids. So go ahead and hold your breath. Okay, so with that, we're listening for any rugies, which would indicate carotid stenosis, which I don't hear any. And then next, we're also going to go ahead and just take a look at the anterior chest. Same thing, look for any abnormalities, asymmetry, abnormal findings. And then we're also going to be looking for any pulsations, which we don't see any. And we're going to go ahead and listen to the heart sounds. So first we'll do the aortic, and then the pulmonic, and then the Erb's point, and then at the apex. Okay, while we're listening at the heart, we're going to listen for any rubs or friction, as well as any extra gallop sounds, S3, S4 sounds, but these are just S1 and S2 sounds. For the next portion of the exam, we're going to start out with the musculoskeletal and neural exam. Okay, to start our musculoskeletal exam and neural exam, we're going to go ahead and start at the shoulders, feeling the joint for any bulging, looking for any inflammation or areas of pain. And we're going to go ahead and test range of motion of the shoulder. So go ahead and raise your arms straight up. Okay, and then as far back as you can. So while he's doing that, we're listening for any clicks, popping, any signs of pain. Next, we're also going to check for abduction. So go ahead and bring them up and bring them in. And then go ahead and rotate. And then cross one shoulder in front of the other. Okay, and bring it back. Okay. Next, we're going to test the strength. So go ahead and go out. Okay. And then go ahead and go in. Okay. Same thing. We're going to go down to the elbows, feeling the joints. Okay. And we're going to go ahead and flex and extend. Okay. And then go ahead and rotate internally for pronation and supination. And then next, go ahead and hold your hands up front and try to resist. Okay, and then other way. Okay. And then next, we're also going to do the same thing with the wrist. Go ahead and go up and down. Okay. And then go ahead and go side to side. All right. At the same time, we'll feel the joints here. No pain or clicking felt. Okay, go ahead and go flex up. And then flex down. All right, and then we're going to move on to the hands, to the joints of the hands. Okay. And then same thing, go ahead and flex up and down. Okay, and then open and close. Okay, go ahead and grip my fingers. Okay, and then go ahead and resist my movement out. Okay. So upper extremity strength is going to be equal on all sides. And then next, we're also going to go ahead and just while we're looking at the upper body, check the neck and the head. So go ahead and rotate your head side to side. And then go up and down, flex up and down. Okay, and then bring your shoulders to your ears. Okay, next, go ahead and turn your head to the side while I resist. Okay, same. Okay, next, we're also going to be checking the spine back here, looking for any bulging or herniations, looking for kyphosis, lordosis, any abnormal curvatures of the spine. And we're going to go ahead and have you stand up and then turn side to side, just your body. Okay, and then go ahead and bend forward and backwards. Alrighty, and then next, we're going to go ahead and you can have a seat. Okay. Next, for the next part of the assessment, we're going to go ahead and check for touch receptors. So go ahead and close your eyes and tell me if you feel soft, sharp, or dull.
Dull. Sharp. Soft. Dull. Soft. Sharp.
Okay, go ahead. You can open your eyes. And then next, we're going to go ahead and check coordination by go ahead and putting your finger to your nose and going out and close your eyes. Okay, back to your nose. Okay, now your other hand. Okay. All right, and with your eyes closed, go ahead and tell me what I put in your hand. Go ahead and hold out your right hand.
Chest piece.
Okay, go ahead and hold out your left.
Coin.
Okay. Okay, you can open your eyes. All right, next we're going to go ahead and check for reflexes of the upper extremities. I'm going to go ahead and have you loosen up your arm as much as possible. Okay. And I feel for the triceps tendon. Okay. And then we're also going to go ahead and relax here for the biceps tendon. Okay. And then also the brachioradialis. Okay. And we'll go ahead and do the other side as well. Relax. Okay. Okay. And then watch here. Okay. So all the tendon reflexes are intact on the upper extremities. Next, we're going to have the patient go ahead and stand up for me, and we're going to have you walk and then come back. Okay. And while he's walking, we're just assessing overall gait, any asymmetry to the gait, as well as looking at the hips for any asymmetry there. Also, any issues with pain or walking. So everything looks fine. Okay, go ahead and have a seat. And for the next part of our assessment, we're going to go ahead and have the patient lie down to assess the hips and the knees as well as the abdomen. Okay, so with our patient lying down, first we're gonna assess the hips for abduction and adduction. So go ahead and move your leg over your other leg. Okay, and out. Okay, and same thing for the other side. Okay. Now go ahead and do it to resistance. Go ahead and go in. And then go out. The same thing. Okay. Okay. And next we're gonna do the same thing with the knees. Go ahead and flex and extend both knees. Okay. And go ahead and do it to resistance. Okay. 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 And then next we're gonna also check the ankles and the feet. Go ahead and rotate your ankles. And then flex your feet up and down. Okay, now flex to resistance. And again. Okay, next we're gonna have you run your heel from one foot over the shin of your other. Okay. Alright, and then next we're gonna go ahead and test for sense perception. So go ahead and close your eyes. Tell me if it's dull or sharp.
Dull. Dull. Sharp.
Okay.
Dull.
Okay, sounds good. And we're gonna go ahead and also, while he's lying down, check his abdomen. Oh, sorry. First, we're actually gonna check the deep tendon reflexes of the lower extremities as well. So go ahead and just relax the knee for me. Okay, and this one. Okay, and then we're also gonna check the Achilles. Okay. So the deep tendon reflexes are intact. Now we're going to go ahead and inspect the abdomen, look for any abnormal pulsations, any bulging or hernias, looking specifically at the abdominal aorta for any pulsing or bulging there. Next, we're also going to take a listen to the bowel sounds. And then while we're listening, we're also going to go ahead and listen for any release. Okay. So no bruits were heard. Next, we're going to go ahead and start percussion of the abdomen, listening for tympani in the general abdominal area, hyperresonance where the epigastric bubble would be, or any dullness if the spleen were enlarged if it shifted this way, as well as listening for dullness of the liver border. So we're going to go ahead and do that. Okay. Okay. And next, we're going to go ahead and start with light percussion of the abdomen, looking for any rigidity, any rebound tenderness, or guarding of the abdomen, as well as feeling for any masses as well. And then along with the light palpation, we're going to go ahead and deeply palpate for any organ enlargement. As well as if we can feel the bladder, which we don't. And next we're going to go ahead and have you take a deep breath in and then out. Okay, one more time, deep breath in and out. Feeling for the liver rise and fall with the inspiration. We'll go ahead and turn this way onto your right side and we're going to feel for the spleen. So we're going to feel here. Go ahead and take a deep breath and out. Okay, and one more time. Okay. So no spleen enlargement there. We're going to have you go ahead and sit up and we're going to feel for kidneys and CVA tenderness. Any tenderness or pain there?
Mm-hmm.
Okay. And throughout the whole exam, we're listening for general status of the patient, any pain, as well as any slurring to speech, any confusion. And we're also just going to go ahead and assess orientation. So what's your name?
Jason.
Okay, and what's today?
August 8th.
And who's the president?
Biden.
And then I'm gonna name two objects. Tell me what they have in common. Salt and pepper.
Flavor.
Okay. Cat and dog.
Pets.
Okay, so we're just checking for general abstract reasoning, common knowledge, different things that can tip us off to any abnormalities. This is concludes our exam.